The Indian Health Service is the 18th largest healthcare system in the United States. We serve nearly 3 million people from more than 574 tribes. When I started with Indian Health Service in 2022, they laid out a path and a plan for us and a set of priorities, and one of those priorities is accurate and timely diagnosis. The Indian Health Service has undertaken a multi-pronged approach in addressing early dementia detection and accurate and timely diagnosis. We currently fund grantees across the country, and what we're seeing in that work is that every community is building and doing the work differently because they're based on the local community needs.
The MiniCog is a screening tool. What can we do that helps us see the person in front of us as who they are and help us respond to what they need?
When I give talks about this to our staff, I say actually diagnosis begins at the front door. Our front desk staff and our folks taking calls about appointments and care coordination are actually the first to recognize some of these issues. One of the pilots that we actually initiated was having primary care docs start doing MiniCog exams in the clinic when there was any sort of concern that an older adult might be experiencing cognitive impairment. We actually increased the percentage of visits that had a memory care issue as one of the diagnoses or one of the purpose of visits by a significant amount over the course of a few months, and we were able to then expand it to other teams. Now we actually have an entire once-a-month clinic that I run where primary care docs are able to recognize cognitive impairment in their own clinics and then consult with me about further diagnostics and really trying to get patients additional support.
In 2023, the Community Health Representative Program began working with the IHS Alzheimer's Program to improve cognitive health screenings in community settings. We launched a 6-month pilot where CHR programs used the MiniCog in their local communities. 6 volunteer sites participated, conducting 193 screenings. Due to the success of this pilot, we launched a second cohort to include additional CHR programs.
My experience with the Geriatric Nurse Fellowship Program was positive. It was a lot of learning. I had never really focused on Alzheimer or dementia. It educated me, gave me the tools to kind of identify, to see, and to kind of become more aware of what this new disease process is.
The one suggestion I have for a health system or community is just do it. Like, get started, they can come through our workforce development program, they can apply to become a grantee, they can participate in our CHR pilot process. We've created so many pathways, and we're here and ready to support communities who want to get that work started.